The latest HSE data on work-related ill health across Great Britain for 2024-2025 provides a clear picture of the scale of workplace health issues and their ongoing impact on workers and employers. The HSE reports that 1.9 million workers suffered from work-related ill health last year. This includes both long-standing conditions and new illnesses. Of these, 730,000 were new cases, showing that nearly 750,000 people developed a fresh health problem directly linked to their work during 2024-2025. The effect on productivity is substantial. Work-related ill health accounted for an estimated 35.7 million working days lost in the past year. These absences cover recovery time, treatment and ongoing management of health conditions, and they represent a significant operational and financial impact on businesses of all sizes. One of the most sobering stats relates to long-term health consequences. The HSE estimates that around 13,000 deaths each year are linked to past exposures at work, primarily exposed to chemicals or dust. These conditions often develop over many years, reminding us of the crucial importance of early prevention and effective workplace controls. When we look at the long-term trend, the data shows that rates of work-related ill health were broadly flat before the coronavirus pandemic. However, in each of the last 3 years, the rate has been higher than the 2018-19 pre-pandemic level. A similar pattern is seen in working days lost per worker, previously stable but now clearly above the pre-COVID levels. The figures also show how different types of ill health contribute to the overall numbers. In 2024 and 2025, 52% of cases were due to stress, depression or anxiety, affecting around 964,000 workers. 27% were linked to MSDs, with 511,000 people affected. And finally, 21% were categorised as other types of illness, accounting for 392,000 cases. These three categories give us a strong indication of where organisations need to focus their health and well-being strategies, including mental health support, ergonomic improvements, safer working practices and early intervention. Finally, the long-term data on ill health rates per 100,000 workers shows significant fluctuations over the last 2 decades, including clear disruption during the pandemic years. What is most important today is that work-related ill health has not returned to earlier levels. It remains higher and employers need to act proactively to support workers and reduce preventable illnesses. These stats underline the importance of prioritising workplace health alongside safety. When organisations invest in well-being, prevention and supportive working environments, everyone benefits: employees, employers and the broader economy.